we all talk about stress a great deal, and certainly under the COVID dynamic, we've all had a lot of stress with adjustment or not adjustment. It's made us pretty lit up in terms of our psychological well-being. So a lot of us have what I call kindling. You're like a piece of kindling on a hot fire, a little more heat bursts you into flame, and everyone seems to have a certain level of moral outrage about one thing or another these days. And that's something we don't like. That's why we teach meditation, for example, in cardiac rehab. And what we're doing there is we're helping you build a point of balance so that you recognize when you're off balance, you have the ability to bring yourself back on balance. That's our second best platform to be physically and psychologically well, next to physical strength through activity or exercise. Those are your real preventive kinds of things, even if you are stressed out, because it takes that jazz up, but that's not just psychological, running the thoughts in your head and thinking too much and not being able to sleep, but it also, and those things boost you up physiologically. If we can get you stronger and we can get you chilled down, you're going to be a lot healthier. And that also allows you to platform yourself to make behavioral changes so you're not eating too many Doritos at 5 p.m. or something like that. We first found out that people with heart attacks were type A, hurry up, get it done people. And they had more heart attacks than type B, laid back people. Well, further research showed us something we called type H for hostility. They were irritated and smoldering anger, sort of, and then had those explosions, and that was really a marker of possible heart attack from a behavioral or a personality standpoint. And really we've gone much further than that, and now we know that depression, anxiety disorder in particular, are really contributors to bad heart health. A lot of it is because that smoldering kind of reaction we have psychologically, and there's certainly a lot of that to go around right now. And so we don't want people to be depressed or to have panic disorder. People who've had a heart attack or a cardiac event and have panic disorder have a 3 or 4-fold time increase of possibility of having another event. People who are depressed have a 2 times likely possibility of having a heart attack, and their mortality is worse than if you don't have depression. So, for example, in cardiac rehab, we've now assessed depression, and we had great results in our last statistical year where we moved people with depression up 80% of them out of their depressed state by cardiac rehab. After some cardiac concern, a heart attack, bypass surgery, those kind of dynamics, our UNC cardiologists often refer to cardiac rehab, where we've had wonderful success. We have a gold standard cardiac rehab program. So we're addressing physical health, we're addressing medications, we're addressing diet, we're addressing behavioral things like quitting smoking, those kinds of things. We've amazing results, really, frankly, statistically. We take somebody who hasn't exercised since 5th grade and we get them a whole lot better very quickly in the 36 weeks of cardiac rehab. So effective is that Medicare over the past 5 or 7 years has increased their reimbursement for cardiac rehab substantially, off of a rather low reimbursement to a high reimbursement, and that speaks to the benefit of cardiac rehab.